Hello, ladies and gentlemen. I would like to say thank you to all of you who attend this event and watch this presentation. Let me introduce myself. My name is Fatkhul Ulum. I'm a student in Nursing Department, Faculty of Health Sciences, University of Jenderal Sudirman, Indonesia. Now I'm going to deliver my presentation, so welcome to my presentation. The clinical efficacy of aloe vera for first and second degree burn wound healing, a review. Burn wounds are a global health problem and the majority occur in developing countries including Indonesia. Burns can cause both physical and psychological impacts. Besides of complication, the problem of burn patients is the process of healing burns, which takes a long time and of course also spends a lot of costs. Not only that, until now there are still many people who treat burns in ways that are not medically recommended, such as using toothpaste in burn wound treatment. Even though the substance contained in toothpaste can worsen the condition of the wound, trigger infection, and cause the skin to become blistered and get more damage. These problems make people tend to choose more affordable alternative therapies. One of them is by utilizing natural ingredients. Alternative options such as aloe vera are the right way to solve the problem of treating burns. Aloe vera is a plant that thrives in almost all continents, especially in tropical climates such as Indonesia. This herb is one of the oldest medicinal substances used in wound healing. Alternative options such as aloe vera are the right way to solve the problem of treating burns. The widespread utilization of aloe vera gel in the community for skincare or cosmetic ingredients can be used as an opportunity to divert bad habits of society in treating burns. Aloe vera is more affordable, and even some studies state that it has better effectiveness than conventional methods that have been used in healthcare facilities for treating burn wounds. Formulation of the problem. Many studies have shown that aloe vera was proven to be effective in treating first to second degree burns. It is necessary to study the results of these studies, especially those using human samples, so that it can be used as a reference basis in evidence-based practice of using aloe vera for the treatment of burns in nursing. The main problem is, how is the clinical efficacy of aloe vera as a wound care therapy in patients with first and second degree burns? This literature review was conducted with the aim to analyze the results of several studies that focused on the use of aloe vera as a wound care therapy in patients with first and second degree burns. Pico framework were used in this study with P patient with burn wounds, I with aloe vera, C with given different treatment with this study group, and O is promoted burn wound healing. Keywords that was used in this literature review is burn, aloe vera, first degree burn, and second degree burn. Database or search engines that were used in this literature reviews are Science Direct, Google Scholar, and PubMed. Inclusion criteria. All studies using gel, ointment, cream, or other formulation made from pure aloe vera derivatives or mixtures with other substance for the treatment of burns, first and second degree burns, and journal articles from 2015 to 2020. And the exclusion criteria. All studies using animal models, research that had limited access to the full text of the article, and third degree burns. These are process of research article selection. In the phase of identification, we got 1,605 articles, and number of articles after removal of duplicate articles The sum is 1,565. And articles removed by initial screening, there are 1,541. And articles that are reviewed and do not meet eligibility, there are 17 articles. And articles that have limited access to the full text of the articles, there are 2. And finally, we got 6 articles were selected according to inclusion and exclusion criteria. These are the 6 articles. The first the articles by Gurdosi et al. In 2015 with the title Aloe Vera Gel Effective Therapeutic Agent Against Multi-Drug Resistant Pseudomonas aeruginosa Isolates Recovered from Burn Wound Infection. The study used a static group comparison design, and the study sample were 140 clinical isolates of P. aeruginosa. During the 6 months of the study, 140 clinical isolates of P. aeruginosa were collected from patients admitted to a hospital burn wounds in Tehran, Iran. And antimicrobial susceptibility tests were carried out against the pathogens using the aloe vera gel and antibiotics such as imipenem, gentamicin, and ciprofloxacin. And the second article is Keorokhana et al. 2015 with the title Prospective Randomized Controlled Comparison Between Silicone plus Herbal Extract Gel versus Aloe Vera Gel for Burn Scar Prophylaxis. The study design used a prospective double-blinded randomized controlled trial model, and the samples was 70 outpatients in the burn unit of Siriraj Hospital, Mahidol University, Thailand. And patients were randomized into 2 treatment groups. The study group was given topical silicone plus herbal extract gel, and the control group was given aloe vera gel. Post-burn scars was graded using the modified Vancouver Scar Scale. And the results from both groups were compared using t-test. The third article is Muangman et al. 2016 with the title Clinical Efficacy Test of Polyester Containing Herbal Extract Dressing in Burn Wound Healing. The study design used a simple randomized prospective clinical study. The study sample was 35 patients with second-degree burn who were treated at the burn unit Siriraj Hospital, Mahidol University, Thailand. The study group of patients using polyester containing herbal extract dressing, and the control group of patients treating with dressing that are commercially available at the common use. And the fourth article is VERA et al. 2017, the effect of aloe vera gel and nitrofurazone on dressing related pain of superficial burn wounds. The study design used a quasi-experimental, and the sample were 30 patients were selected non-randomly among the outpatient referring to burn section of Karman Shafa Hospital, Karman, Iran. Each patient randomly selected a treatment. These areas were similar in 2 sides of the body and had equal burn degree. In the control area, burn wounds were washed every day with normal 0.9% saline and 2% nitrofurazone ointment. In the intervention area, aloe vera gel was used after washing the wound with normal saline. The fifth article, Wallace et al. 2019, with the title Efficacy of Dressing by Aloe Vera Gel on Healing and Pain Among Burn Patients. The study design used a quasi-experiment. The study sample was 50 patients who were admitted to the burns unit at the burn units and burn outpatients clinic of Shebin El Kham Teaching Hospital at Shebin El Kham District, Manu via Governorate, Egypt. The samples were divided randomly and alternatively into 2 equal groups, each containing 25 patients. The study group was given burn dressing with aloe vera gel, while the control group was given routine hospital burn dressing in the conventional way according to hospital standards. And the last article is Zabakzadeh 2020 with the title Comparison of the Effectiveness of Aloe Vera Gel with 2% nitrofurazone ointment on the Healing of Superficial Second-Degree Burn Randomized Clinical Trial. The study design used a randomized split body control clinical trial, with samples was to 30 outpatients with superficial second-degree burns at the burn center of Shafa Hospital Kerman Imran. 30 patients with at least 2 burns, each burn on alternate side of the body. Samples were divided into 2 groups: the study group who received aloe vera gel and the control group who received 2% nitrofurazone ointment for the treatment of their burns. The instruments that was used in this study is the Betz-Janssen wound assessment tool for evaluating burn healing. Results and discussion. From the first article, Guru Rasi et al. 2015, the antibiogram showed that 47 of all isolates were multi-drug resistant. P. aeruginosa, the extract isolates from aloe vera, had antibacterial activity against all isolates. There were 42 isolates inhibited by aloe vera gel extract at minimum inhibitory concentration less than 200 microgram per milliliters. The MIC value of aloe vera gel for other isolates was 800 microgram per milliliters. All of MDR P. aeruginosa strains were inhibited by aloe vera at similar MIC 50 and MIC 90 to 100 microgram per milliliters. Based on the result of this study, aloe vera gel at various concentrations could be used as an effective antibacterial agent in order to prevent wound infection caused by P. aeruginosa. From the second article, Kirohan et al. 2015, total MVSS was different in both treatment groups and was statistically significant from week 12. Pigmentation, vascularity, and pliability scores in the study group were significantly lower than in the 2 group at week 16. There were no statistical difference in pain and height between the 2 groups. And in the conclusion, the silicone plus herbal extract gel appears to be superior to aloe vera gel in the prevention of hypertrophic scarring. From the third article, Muhammad et al. 2016, patients in the study group had faster healing than the control group. In the study group, there was 1 infection of Pseudomonas aeruginosa on day 7, so that the treatment required to be replaced with standard procedures in the burn unit. These volunteers were excluded from the study, so there were only 17 patients in the study group. There was no report of infection in the control group. There were no unfavorable clinical symptom or sign or side effect were found in both the groups. The result of this study concluded that herbal dressing containing aloe vera 2.5% and Centellica asiatica 5% healed burn faster and were significantly associated with shorter length of stay than standard wound dressing. And the next article, VERA et al. 2017, statistically significant difference in the control area and the intervention area were shown in terms of pain intensity at 24, 48, and 72 hours after starting treatment, and pain intensity was significantly reduced over a 72-hour period in both areas. However, aloe vera gel could reduce pain more and faster than nitrofurazone. The fifth article, Wallace et al. 2019, the results is most patients in the study group didn't experience wound infection, while 48% of patients in the control group had wound infection. The rapid healing process occurred, decreased pain levels, and length of stay was shorter among the study group after dressing application with aloe vera gel than the control group. It could be concluded that aloe vera gel could improve the healing of first and second degree burns better than traditional dressing and management methods. It also reduced pain levels, so that could make lesser length of patient hospitalization stay. And the last article, Sabakzadeh et al. 2020, there was a significant difference in BW80 scores between the study group and the control group. BW80 scores between the 2 groups had significant differences at the second and third weeks. BW80 scores in the 2 groups decreased significantly over time. Aloe vera gel was as effective as nitrofurazone ointment in the treatment of superficial second-degree burns. Burns heal significantly faster in the zone using aloe vera gel. Wallace Shehata and also showed that aloe vera gel could accelerate the healing process of and reduce pain in first and second degree burns. This was due to several mechanisms including increased collagen synthesis and epithelialization rate by the effects of acemanan and mannose 6-phosphate M6P to stimulate fibroblasts, anti-inflammatory effect, antimicrobial effect, and moisturizing effects. The results of this study are also supported by other studies. Muhammad Sabakzadeh, Varey, Ranjpar, and Bostani. These are aloe vera content. There are vitamins, enzymes, minerals, sugars, lignans, saponins, salicylic acids, and amino acids. The growth factor in aloe vera contributes to wound healing by stimulating fibroblasts to produce more collagen. Aloe vera gel aloe vera gel not only increase the wound collagen content but also change the collagen composition more in type 3 and increases the degree of collagen bond so as to accelerate wound intrusion. It can improve the remodeling process of the wound, and aloe vera is also able to maintain a moist environment in the wound and at the same time bring oxygen to penetrate into the wound so that it can increase the cell regeneration process. Acemanan and glucomannan are the two main functional components of aloe vera. The anti-inflammatory effect of aloe vera is a result of mannose 6-phosphate and acemanan. Glucomannan and acemanan were proved to accelerate tissue regeneration, activate macrophages, stimulate the immune system, and have antibacterial and antiviral effects. These constituents can reduce inflammation caused by increased prostaglandin synthesis and increased leukocyte infiltration. Aloe vera inhibits the cyclooxygenase pathway and reduces the production of prostaglandin E2 and thromboxane from arachidonic acid so that it can reduce the inflammation. Aloe vera can reduce inflammatory and increase blood flow by inhibiting the synthesis of the vasoconstrictor thromboxane A2. Three studies which were conducted by Wallace et al., Muhammad et al., and Varey et al. State that aloe vera could reduce pain in patients with second-degree burns. The carboxypeptidase in aloe vera was able to deactivate bradykinin, which was a strong factor in acute inflammatory pain. Magnesium lactate in aloe vera gel could also act as anti-pitching and analgesic by inhibiting histidine decarboxylase to control the conversion of histidine to histamine in mast cell, which could stimulate itching. Sometimes the process of changing dressing is one of the procedures that can cause severe pain in burn patient. Muhammad et al. State that it could be solved by using dressing that had a low adhesion. Dressing impregnated with lipidocolloids had less adhesive to burn wounds, added with the beneficial combination of aloe vera and Candela asiatica, could reduce the effects of tissue destruction and neopithelium, which cause less bleeding and reduce pain during dressing changes in second-degree burns. In the Muhammad et al. Study, there was one infection of Pseudomonas aeruginosa on day 7 in the study group, which was given treatment with herbal dressing. It made the volunteer drop out from the study, whereas in other study conducted by Gurdasi et al. Explained that aloe vera gel at various concentration could be used as an effective antibacterial agent to prevent wound infection caused by multi-drug resistant P. aeruginosa. Aloe vera also had antibacterial and antifungal activity against 5 bacterial cultures of Bacillus subtilis, Salmonella typhi, Escherichia coli, and Staphylococcus aureus, and 3 cultures of the fungi Aspergillus fumigatus, Candida albicans, and Penicillium species. Aloe vera had good antimicrobial properties even in minimum inhibitory concentration at very low concentration. In the process of healing burns, the formation of hypertrophic scar tissue might be occurred. This proliferative scar tissue is characterized by increased levels of collagen and glycosaminoglycans and also increased collagen turnover. Study results by Kerohana, Chayasuk, and Muhammad mentioned that aloe vera gel could be useful in preventing the formation of hypertrophic scar, but its effectiveness will be better when combined with other substances such as in silicone gel added with herbal extract consisting of Ulum cepa, Tamarindum indica, Centella asiatica, and aloe vera. Silicone plus herbal extract gel was superior to aloe vera gel in preventing the formation of hypertrophic scar because it contained more active ingredient. It was also supported by Surakumprava et al. In their study, which said that silicone gel plus herbal extract were effective for scar tissue repair. The benefits of aloe vera in preventing scar tissue formation cannot be ignored, although the results state that the total MVSS value was significantly different from week 12 in the two treatment groups. It should be noted that the only significant differences were in score were pigmentation, vascularity, pliability, and itching, whereas there was no statistically significant differences in the pliability, pain, and wound head scores between the two groups. It was caused there was aloe vera extract in both gels. Aloe vera extract had inhibiting properties natural cyclooxygenase 2 or CHOX2, which could reduce pain and inflammation. The double-blind method in research can reduce the risk of bias and subjectivity that might be occurred. Only a study that was conducted by Kerohana, Chayasuk, and Muhammad used a prospective double-blind randomized control trial model. And several studies have also combined aloe vera with other substances to obtain maximum results. It was found in study conducted by Muhammad and Kerohana, Chayasuk, and Muhammad. There are two studies that conducted research with the same study group and control group, specifically comparing aloe vera gel with 2% nitrofurazone ointment. There was no unfavorable clinical symptom or signs or side effects were found from the utilization of aloe vera for the burn wounds treatment in all studies reviewed in this literature review. For also the conclusions are based on the review on several selected articles. It could be concluded that aloe vera had good effectiveness in the healing process of first and second degree burns. All articles reviewed revealed the good effectiveness of aloe vera for the treatment of first and second degree burns. Aloe vera can be used for the treatment of burns because it had properties that could act as antimicrobial, antiseptic, anti-inflammatory, anti-itching, and moisturizing, was able to reduce pain, increase the cell regeneration process, increase collagen synthesis and epithelialization rate, accelerate the wound healing process, and prevent hypertrophic scar formation. And the suggestions are for health services. Hope that healthcare workers can utilize aloe vera as a therapeutic option for the treatment of first and second degree burns, and the basis of consideration from the side of therapeutic effectiveness, affordable cost, and easy access to aloe vera in the community. And for future studies are needed to compare more specifically aloe vera with other therapies. Specific dosage, contraindication, and side effect of aloe vera in burns also need to be studied deeply in future studies. In addition, examining the benefits of aloe vera in wider scope, for example in third degree burns, also need to be further studied so that can support the application of evidence-based practice in nursing. So that is my presentation. Thank you for your attention.